Today I wanted to talk about non-surgical management of uterine and vaginal prolapse as well as stress urinary incontinence. As we age, the pelvic muscles become a little bit lax, the elasticity of the vaginal mucosa decreases, there is dryness, but because of the laxity, the organs which the pelvic muscles are holding, which is a bladder, your uterus, as well as rectum, they start sliding down, and that's what causes prolapse. There are several reasons for prolapse apart from your age. It could be after childbirth because of the muscles in the pelvis are damaged with the childbirth, repeated childbirth, especially large babies, episiotomies, or also tears, vaginal tears, if they don't heal properly, can heal with scar tissue and cause damage to the musculature and cause prolapse. Now, to show you a picture of the side view of a female pelvis, this is how it's a side view. So this is an abdominal wall, this is vagina. On the top of the vagina is the uterus. In front of the uterus sits the bladder, and behind is the rectum. So you can see the uterus is on the top of the vagina, and so is this bladder, and a rectum are above these pubic bones. But what happens into the pelvic organ prolapse is this organ starts sliding down. So uterus, which was right on the top of the vagina, slowly slides down to the point that it can actually pop out of the vagina. That is the stage 4 prolapse. So when this uterus is falling down, it will pull the bladder, which is also sliding down, and the rectum, which is also sliding down. So whenever you get a uterine prolapse, you can also see a bladder prolapse, which we call a cystocele, and a rectal prolapse is a rectocele. So how can we manage this? How can we treat this without actually doing surgery? So the first and the foremost important way of treating it is to do the pelvic exercises. All of you must have heard about Kegel exercises, right? Your gynecologist is always telling you to do Kegel, do Kegel, do Kegel exercises. What is that for? That is to make those pelvic muscles stronger. But a lot of women don't know how to do pelvic exercises or Kegel exercises. So a lot of time we send them to pelvic physical therapy, where a physical therapist will actually treat you or teach you how to do these Kegel exercises. And obviously you're gonna have to do it on your own at home. A lot of time health insurances don't cover this pelvic physical therapy. So then what's the woman to do? In those cases, there are few devices on the market which are available, and there are lots of them. They are called biofeedback devices. Some of them have got the connection with your phones, and you can play some games while doing the exercises. Some of them will make some sounds and noises or color changes, which will show you that you are doing the Kegel exercises right. There's a lot on the market. You can do your research and find out. What I find very useful for my patient is to use something called vaginal weights. So that again, there are lots of vaginal weights available even on Amazon, and you can do your research and find which one you want to use. But consistent use is the most important thing I wanted to tell you about. So the one I recommend to my patient, they look like these little tampons. They look pretty, aren't they? They're pink in color. And they start with a very lightweight tampon. You put it in the vagina and you try to hold it for about 10-15 minutes or so. So once you can hold this weight, then you go to a higher weight and a higher weight and a higher weight till you can hold the heavy tampon or a weight in the vagina for 10 to 15 minutes. So what basically you're doing is you're building the strength of your pelvic muscles, and when they can hold a heavy weight, obviously they can hold your uterus and the bladder too. It takes time, consistent use daily for 10-15 minutes. In about 2 to 3 months time, you will see that prolapse is slowly decreasing. You're not gonna see as much of it popping out. As well, you will see difference in your urinary incontinence. It will improve slowly but surely. Again, you're gonna have to continue doing it to maintain it, but that's one way of easily doing this exercise at home and non-surgically managing the prolapse as well as the urinary incontinence. Second way of treating non-surgically the uterine prolapse as well as urinary incontinence is with certain devices which have been FDA approved now. They have got two basic principles. Some of the devices use radio frequency waves, and some of them they use laser. So basically, both of them, the way they work is that they are gonna cause some kind of a thermal damage into the vagina. So with the thermal damage, there is a formation of new collagen, new elastic tissue. So because there's an extra new collagen and elastic tissue is formed, the vagina gets tighter. There is a new blood vessel formation or neovascularization which happens, which increases the blood flow to the vagina, and it increase the elasticity, it will increase the lubrication, and it will also improve the appearance of vagina. So whether it is the laser or if it is the radio frequency wave, the whole vagina is treated from the top to the bottom, and hence the bladder anteriorly and the rectum posteriorly is also treated. Most of these treatments take less than 30 minutes. They are completely painless and there is no downtime at all. The recovery is very fast. So a lot of gel, like ultrasound gel is used. There's a probe. The one I use is called Votiva. And in the Votiva, we insert the probe into the vagina, so the whole length of the vagina is treated, and it's turned 360 degrees, so the entire vagina is treated. Now you need one treatment a month for 3 months. That's all. Those are 3 treatments, and by some patients say that the first treatment they're gonna see some difference, but what is recommended is 3 treatments. Some women may need maintenance treatment once a year, 1 treatment a year just for the maintenance. Again, in between, I would recommend you to do the Kegel exercises to keep the tone of those muscles. But this is a very simple and easy treatment, and I would say up to stage 2 prolapse, maybe sometimes stage 3 prolapse, as well as moderate urinary incontinence can be very easily treated with this. The third option I wanted to inform you is called vaginal pessary. Have you heard the name pessary ever? Pessary is a device which we put it into the vagina to hold the uterus, the bladder, the rectum, anything which is prolapsing out up so nothing falls out. Now there are different kinds of devices on the market, multiple of them. The one I'm very comfortable using and which I like to use is called a ring pessary with support. Here I wanted to show you how a pessary looks like. So there are different sizes of this pessary. It basically looks like a dish, doesn't it, with a couple of holes in there. So what it is that you need to be fitted for a pessary. Pessary fitting is an appointment your gynecologist will have it with you, where they're gonna measure the length and the width of your vagina to see what size pessary is right for you. You may need a tiny one depending upon how much is a prolapse, or if you have a large prolapse, then you're gonna need a larger one. So once the pessary fitting is done, it is inserted into the vagina and it stays there. Now, I teach my patient how to take it out and insert it themselves, so they can take it out, wash it with soap and water, and reinsert it later. It has to come out during sex. Obviously, can't have sex because this is sitting in the vagina. Now, if you are not sexually active and it's difficult for you to take the pessary out and put it back in, then the pessary can stay there for up to 3 months at a time. You come to our office, we'll put the pessary in, or if the pessary is there, take it out, clean it, and reinsert it for you. This helps preventing surgery in a lot of women who don't want surgery, number one, or who are not a candidate for surgery because they have so many medical issues, or their age is such that they may not be able to handle surgery. So pessary can be used as a short term sometimes. Say for example, you have a prolapse and you're pregnant, then it will hold the cervix up till advanced pregnancy, and then we take the pessary out. It can be used prior to surgery, like you are scheduled for a hysterectomy, a vaginal hysterectomy, and a bladder or a rectal repair, but you don't want to have the discomfort till surgery. It can be used at that time as a short term, or for some women, it can be used as a long term option for years and years. All you're gonna need is to make sure that you're taking good care of the pessary so you're not getting an infection. It is not the best treatment for urinary incontinence, but it helps some, not a whole lot. The best treatment is for this, this is the best treatment for prolapse. But it's an option out there. If that's something interests you, we can always talk about it. But there are so many non-surgical options you can trial before surgery. So why not see your local gynecologist or come see us? We can sit down, assess the severity of your symptoms, and see what is the best option for you.